All right, we're going to start again because even without people in their seats, because I'm mean like that, especially now that Roger's here, we can start on Great Place to Work. Roger, it was a nice, succinct paper. I suspect people have been able to absorb it quite well and want to have a discussion about it. Is there anything you would particularly like to say to introduce it?
Yeah, I just want to add a couple of things, if I may, Chair. I'm going to take it that colleagues have read the paper and hopefully also read the Borman report and the McLeod reports that it refers to, because they're quite important backdrops to this work, which is not just in NHS Direct. Again, you know, as I said earlier, there is a Borman group that is working quite hard on health and well-being, particularly in the NHS more broadly. I just want to add a couple of things. One is that although I have presented some proposals in some detail, what's very important in this sort of work is that it's not delivered top down. So these proposals are subject to revision when they are worked through with managers further down the organisation and indeed with frontline colleagues. So I wouldn't want to take them at this point as being etched in stone, although I imagine that those will be very close to the things that we end up doing. I'd also like to make a comment about the costs and savings related to this. The first thing I would say that this is also subject to our business case process as part of a business planning for 2011-12, and in the first iteration of that has been rejected. So there is work to be done on working this through the business case process as well, and we would be doing some of this if it didn't get through the business case process at all. It would just look different. So there is certainly the capacity to change the costs here, to reduce them. There is also the capacity to include the values work for 11-12 into this as well. So there is a degree of flexibility about how much this can cost. And of course, the other point I'd like to make is that I have not specified savings here. This is an in-principle paper, and the savings will be agreed as part of the business planning process as well. There's a real danger that you quadruple count savings related to work like this. And of course, there are some other things coming through as well. So I don't want to claim savings from improved sickness absence, attrition, etc., productivity, etc., etc., etc. If we don't understand what the effect of this sort of work can be, then we should probably reject it in the first place. So that's just what I wanted to add before we start the discussion.
I'm going to come in first on this, sort of out of the chair, but sort of make my comments about the content. I think it's very, very good to see it. I think we, want and need to do something to make this place a great place to work. So I'm very pleased to see it. I have some specific views about particular elements of it. So I'm going to start with 4.5, the physical environment. Absolutely yes. Don't need to blink on this one as far as I'm concerned. We've got unspent monies on the physical environment, I believe. Trevor, is that right?
We've got £500,000 in the capital programme.
And we have to give people a physical environment which is conducive to their well-being. So that's fine. On 4.4, the Innovations Academy. I mean, I guess my feeling on this is, overall my feeling is focus. We and our staff will get more out of a few things done very well than spreading ourselves too thinly. On the Innovations Academy, I suppose my reservation is this organisation's got an enormous amount on its plate that relates to innovation already. The 111 service, long-term conditions, so on. So I'm just not entirely sure how much more innovation this organisation can cope with at the moment. and have some questions about making sure we don't set expectations too high on that front. I'm going to jump down now to 4.1, communication and involvement. I mean, cascade systems are obviously very well established and well known and have been around for a long time, and their pros and cons are quite well known as well. So we know that they tend to work much better on the downward cascade than the upward, and that there's a number of things that relate to the way that the cascade system works. So I think that I'm happy to support it. We need to watch it quite carefully and make sure that it doesn't substitute for things like NHS Direct communication with the front, with the front line. The one that I suppose I'm most excited about is the health and well-being one, 4.3. I would really like to do this well, because I think that partly we are in the health and well-being business. If we can't do it for our own staff, that's a shame. Partly because the nature of the work that we offer people is not necessarily doesn't add to their health and well-being, in that it's sedentary, it's in locations where people generally have to drive to, the hours are uncongenial. So it seems to me that we have a particular responsibility as a health employer, as an employer supporting other organisations to have healthy workforces, and as an employer whose employment offering can be doesn't enable people to have active lives. So we have a lot of responsibility on this. I would like to see more emphasis on that, and I'd like to see, and I know that the cost of us providing this for external customers is much higher than the amount that we've decided that we've offered to invest here, and I would be very interested in seeing whether we can create a robust business case for doing that really well. The recognition one, frankly, I would delay, partly on the basis of doing fewer things better, and I would like to see, as you've heard, a lot of focus on the health and well-being piece, and partly because I think it's a difficult thing to be selling to the external world at a time where our performance is open to criticism, and where our sickness rates are as high as they are. So I think that recognition there's lots of good things about recognition, but I think if I want to thinking about allocating scarce resources, the health and well-being programme is really the thing I would like to see move forward. And now that is my personal opinion out of the chair, and I'll let other people have their views.
Can I just come back on one thing, Chair, Joanne, depending on who you are at the moment, and that's on the first thing you said about the Innovations Academy, in that this is about improving the way we work and the service we give to the public. It's not to be confused with innovative service development.
Okay, fine. Yeah. Point taken. Ruth.
If I can just add to that, what really impressed me when I was in Nottingham listening to the 111 advisors was the ideas that they were coming up with on that doesn't work, and it would be better if it was like this. So it's really, really valuable.
That's what this is about.
Yeah.
Okay.
Yeah.
And a lot of the internal processes as well, where we've reconfigured structures, but we haven't kind of completed the work on actually making the new structures work.
Okay, I hope I haven't
I agree with
put anybody else off, but Peter.
I was going to say I agree with the Chair's very erudite comments, but
so do I.
And a lot of the things she says, I certainly do agree with. I just wanted to comment on the quality circles part of it, if I may. It's sort of a golden oldie, if you like, of sorts, but I've seen it work very well, extremely well. I've seen it work extremely badly. My take on this is, if we are going to give more responsibility to our first line managers and their staff, then if we take this seriously, we would also need to invest in their time to do it. And I think this is where it gets murky. Simply because it requires that investment in time to get the results. Let's say we took sickness as a priority area for them to concentrate on with their teams, and that's not a bad idea. We would need to have dedicated management time with staff to discuss these things through and allow them some elbow room for their own local solutions, and not necessarily poking our nose in necessarily, other than seeing the results.
Yes.
And I think that's, for me, is what we would need to do with this if we're going to pick this up. I mean, I think our job is to prioritise what they might look at,
yes,
to some extent, but we've got to give them some room if we're going to talk about things they want to talk about as well. Anyway, they were my comments.
No, I think you make a very good sort of, you highlight the cultural conundrum we have with this.
So,
Nick, I saw first. Oh, Forrest. Okay. Nick, Sue, Tim. Were you? Nick, Sue, Tim, Renette, Tim.
Okay. Knock off a few points of where I strongly agree. Physical environment. If you go into the toilets and they smell, it's not a great place to work, and unfortunately that is the case in some of our call centres. And that kind of, just getting that kind of, forgive me for dragging it down to that level, but it's
just before lunch.
Yeah. So sorting out the physical environment, but it is about hygiene factors rather than making everything look absolutely wonderful and having flowers in the hallway, as it were. So I agree with that. I also agree that we need to do something on the positive upside to do with health and well-being. We clearly do have a sickness problem, and we should be stepping up to the mark to work out what we need to improve people's health. Where I think I'm entirely in sympathy with what Peter was saying, if I've understood it correctly, and what's written here in the paper, an effective strategic narrative for the organisation, particularly in times of uncertainty. So what is this organisation really all about, and what's driving it? Managers who genuinely engage with their teams. So people who work for a manager know what that manager is what makes them tick, and what they are, what their values are, and how they're going to help members of the team. How you encourage one member of a team to help another member of a team, and for people to feel good. And I think that's really where we have to invest the time and energy. I think we are at risk of being tokenistic if we employ 4 or 5 people to work on a series of initiatives, but actually structure our team management arrangements such that it's, in practical terms, almost impossible for a team manager to get their team together and have time offline to be able to talk about things that matter. And so for me, it comes down to the flaming obvious that we ought to do in terms of physical environment. Yes, we need to work on a sickness health package and work out what we can do positively on that, but let's invest in our team management structures.